Welcome to this edition of Blood Matters. My name is Andrea Sine. Today, Dr. Lori Suter is going to clarify the difference between component quarantines, recalls, market withdrawals, and lookbacks. Now let's get to our discussion with Dr. Lori Suter.
Hello, I'm Dr. Lori Suter, Vice President of Medical and Technical Services at Carter BloodCare. Today, I'm going to talk about the difference between component quarantines, recalls, market withdrawals, and lookbacks. Quarantines usually occur first, early in a product investigation. The component may or may not ultimately have to be discarded, but we want it pulled out of inventory until the investigation is completed. At Carter BloodCare, we usually do go ahead and return these to the blood center. Market withdrawals and recalls are similar and involve a problem or deviation in normal collection or processing protocol that has been discovered after the component was shipped. These might be errors, or frequently they are what we call accidents, things that happen outside the control of the blood center. A very common example is post-donation information. The donor calls back to tell the blood center something about a medication that they're taking or a risk behavior that is pertinent to the safety of the blood component. Market withdrawals tend to be less important deviations. Recalls are more serious deviations, but both can be reportable to the Food and Drug Administration. The transfusing facility may decide how to act on both recalls and market deviations depending on the situation. The components, however, may already have been transfused. Finally, lookbacks are notifications from the blood center for a donor who is now tested positive for HIV, hepatitis C, or Chagas disease antibody. The facility received a prior unit from this donor in the past. The Code of Federal Regulations defines actions for both the blood center and the transfusing facility for follow-up in these cases. The recipients must be identified, counseled, and offered testing in a specified time period for the appropriate organism. If you have any questions or concerns about a specific recall notification or quarantine, you can call the Quality Assurance Department at Carter BloodCare at 817-412-5580.